Hello, everyone. My name is Alyssa Hong, and today I'll be talking about Alzheimer's disease. I'll be covering what is Alzheimer's disease, the treatment, cause, and also much more information that can be useful throughout your career. So, on this slide here is the anatomy of the Alzheimer's disease. Alzheimer's disease mainly affects the nervous system, especially the brain. The first area that is damaged is usually the hippocampus, which is responsible for forming new memories. As the disease gets worse, it spreads to the cerebral cortex, which controls things like thinking, language, decision making, and problem solving. The disease also damages neurons or nerve cells, making it harder for them to communicate with each other. So the image I have here on the right compares a healthy brain to a brain with severe Alzheimer's. You can see that the Alzheimer's brain has shrunk a lot and has much larger spaces between the folds. This loss in the brain tissue is what causes memory loss, confusion, and other symptoms that become more severe over time. In this slide, it explains how the brain normally works and what changes with the Alzheimer's disease. In a healthy brain, neurons or nerve cells communicate by sending electrical and chemical signals. They use chemicals called neurotransmitters to pass messages from one neuron to another, which allows us to think, learn, remember, and move. The brain also has enzymes that help remove waste and break down unnecessary proteins to keep the brain healthy. In Alzheimer's disease, this communication between the neurons, it becomes damaged. Harmful proteins build up, nerve cells stop working properly, and they eventually die. So then this causes memory loss, confusion, and problems with thinking and everyday activities. And to top it off, genetics can also play a role. This slide explains what goes wrong in the brain when someone has Alzheimer's disease. First, sticky beta amyloid plaques build up between brain cells, and abnormal tau proteins form tangles inside the cells. These plaques and tangles block communication between neurons and eventually cause them to die. As more brain cells are lost, levels of acetylcholine, a neurotransmitter that is important for memory and learning, also decrease. The brain also has trouble removing damaged proteins, so they continue to build up and make the disease even worse. Over time, the hippocampus, which is part of the brain responsible for forming new memories, it begins to shrink. So the image on the right compares a healthy brain to a brain with Alzheimer's disease. You can see that the Alzheimer's brain has more shrinkage, especially in the hippocampus. These changes lead to memory loss, confusion, difficulty thinking, and making it more difficult to complete everyday tasks. Doctors diagnose Alzheimer's disease by doing a physical and neurological exam and asking questions about a person's memory and thinking skills in order to find a diagnosis for the Alzheimer's disease. They also use brain imaging tests like MRI, CT, PET scans to look for changes that are in the brain. They may also do blood tests to help rule out any other conditions that may be causing memory problems. As of now, there is no cure for Alzheimer's disease, but there are medications that can help manage the symptoms and slow the progression for some people. Things to help are healthy lifestyle changes like regular exercise, eating a balanced diet, staying mentally active, getting enough sleep, and all that is going to support brain health. AI is becoming an important tool in Alzheimer's care today. AI can help doctors detect the disease earlier by finding small changes in the brain scans that might be missed. It can also help create more personalized treatment plans and monitor the disease changes over time, which may improve patient care in the future. This slide explains who is most likely to develop Alzheimer's disease and how common it is. The biggest risk factor is age for Alzheimer's disease. So, people who are 65 and older are much more likely to develop it. Women are diagnosed more often than men, partly because we tend to live longer. People with a family history of Alzheimer's disease may also have a high risk, and studies have shown that African American and Hispanic adults are more likely to develop Alzheimer's disease than white adults. In the United States, there are about 7.4 million people aged 65 and older that are living with Alzheimer's disease. Unfortunately, Alzheimer's disease is a progressive disease, which means it gets worse over time and there is currently still no cure. After being diagnosed, people live on an average to 4 to 8 years, but although there are some people who live much, much longer than that. Alzheimer's is also one of the leading causes in death for older adults. And lastly, here are just all the resources that I got my information from for Alzheimer's disease, as well as the links to the pictures that I used. Thank you all for watching.